from Sports Medicine Center at Akron Children's Hospital. On board with me this morning for his Wednesday visit with us is Dr. Joe Congini. Dr. Joe, good morning. What do you have for us today?
Hey, Ray, how you doing today?
I'm excellent, my friend.
Great. Yeah. We're moving into a fun time of year, and one of the things in sports this time of year, if you go to a sporting event, a high school game of any kind, soccer, cross-country meet, football game, if you go to even youth sports, or you go to the office of an orthopedist, a bone specialist, a sports physical therapist or sports medicine, you see a lot of people wearing braces or splints or pads. You see them out on the field, and I wanted to just cover what a component of that that's pretty important in trying to keep athletes play is splints and pads and orthotics and things like that. How do we use them? And I wanted to say a few words about that. You know, every athlete wants to play. The seasons are short. They've worked so hard now, and they've moved into the season, and maybe it's 8 weeks, 10 weeks, 12 weeks of a season. And if they can play and they have an injury and they can be benefited by a brace, they want to know about it. So the braces are used sometimes to keep kids playable. They can play in braces. You see that when you watch a sporting event, if you watch closely. Or it can allow an athlete to heal faster. So number one, they can protect. Like, for instance, with torn ligaments or even stable fractures, little fractures that are called avulsion fractures that are not unstable can be protected by a lot of the different newer braces and splints and things that we have out there. Sometimes, though, we have to face decisions about, hey, this one is not stable enough and it really should be in a cast, but sometimes we can make it a playable cast. So number one is we use them for protection. Number two is that in some cases, a lot of kids in our office have stress fractures or overuse injuries. And what these braces can be used for is to restrict the movement pattern, restrict motion. Very commonly is one in the low back, and that kids can wear a brace, a back brace that may restrict the amount that they're moving and perhaps allow them to play, or perhaps in the early stages allow them to heal over a couple of weeks' time quicker so that they can get back on the field and play quickly. Those kinds of decisions are made by the sports medicine team, but braces can be used to restrict motion. They can be, nowadays, there's different types of braces that can be heated and fitted directly and individually to the athlete. And so there's all sorts of different braces. And a lot of these ones that can be heated and fitted are for the hand, the finger, the wrist, and that's been a whole new area of helping athletes. Not to forget about the feet, at the other side, there are things called orthotics, and a lot of athletes wear inserts or orthotics that get the foot in a certain position to take the pressure off for an injury that occurred, to protect an area, to help heal a stress fracture. So orthotics are also helpful. And so restriction number two is the second thing we use all these splints and braces for. Number three, kind of the last line of defense, is the athletic trainers. Doesn't it always, for me, come back to the real key to the sports medicine team is the certified athletic trainers out at the schools. They have blue foam or tape or a hard plastic called orthoplast where they can kind of individualize. If the doctor says, hey, just protect this one area so that this athlete can play. And trainers are famous for being able to come up with individualized splints and pads and braces to allow athletes. And the key to the whole thing is to keep kids playing, but keep them playing safely, not to take any chances for their future. And that's what things in the brace world or the splint world can do to help athletes stay out on the field.
All right, Joe. Great information. Good work, too, on certainly keeping these athletes safe, well, and taking in all different angles. Good stuff for us this morning, my friend. Appreciate it. We'll catch back up with you next week.
Thanks, Ray. We're moving into a real fun period in the sports world, so enjoy it, okay? And have a great Labor Day.
I agree. You as well. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital with us.